Hi, my name is Dennis Schackmann and I'm a clinical engineer here at Dräger. Today I want to take you to our showroom we've created in our lab to show you the possibilities of device interoperability via SDC. Imagine we are on a COVID ICU and we will enter an isolation room right now. Our patient was extubated a few days ago. As pneumonia prophylaxis as well as diaphragm training, he shall now receive NIF trials up to 4 times a day and overnight. After the daily visitation, the therapeutic team, which means the caretaker who's responsible for the patient, respiratory and occupational therapists as well as physicians, sets the ventilator to the current patient needs, and I will now start the first NIF trial of the day. After checking that the patient tolerates the NIF, I will set the saturation limit on the monitor and decrease the flow rate of the medication pump. And after a quick check of our patient, we can now leave our isolation room. We will stay now some time in the anteroom of the patient's room, doing our documentary and check one last time our monitoring and ventilation data on the core. At last, we will start an NIBP measurement. And due to the default time interval on this ward of 15 minutes, the interval will start now, and we will check our initial measurement before we leave this room to check our other patients. Now that we see that our patient is under stable conditions, we can check our other patients. I just received a tidal volume high alert on my mobile device, and the same alarm will occur on the ASCOM Digistat Smart Central Station, so that my coworkers are informed if I'm not able to take over the alert. To check now the urgency of this alarm, I will use the cord to check vital signs of my patient. As well as visually check through the window of the door that my patient is stress and pain-free. It looks like the patient just had coughed, so this requires not current action. We will now check the rest of the syringe pump volume and prepare our next visitation of the patient in his isolation room. And it looks like the pumps are not empty at all, so I can prepare now my syringe pumps and will enter the isolation room. Now that I have prepared a new medication syringe, we are ready to enter the isolation room. And it looks like just in time. There is an occlusion alarm telling me that the patient maybe is lying on the intravenous line of his medication. We will enter the room, fix the problem and change the syringe. Now that I stopped the alarm on the pump, I'm able to change the syringe and restart the medication therapy. Also, I will stop the first NIF trial of our patient. At this point, our showroom will end. I hope you enjoyed what you just saw, and thank you all for watching. For further information about the standards and protocols we used, please read our white paper. Thank you all and goodbye.